hospitalists, because now when you go to a hospital, you can't expect to see your own doctor.
That's right.
You have no idea. Some guy or gal, female, is going to show up in your room and say, "Hi, I'm your doctor," while you're here.
Right.
And they're a total stranger.
Right.
And they've got however many, too many patients to have to deal with. So what's the best way to deal with a hospitalist?
Well, you're right. There's been an enormous trend in this hospitalist movement. And hospitalists are really taking care of you while you're in the hospital. So what kind of information can you give them that will make their job easier and make you kind of stand out from the other patients if you need attention? Well, one is give them a list of your medications. And on the same sheet, maybe write down what your major medical problems are. And then the names and contact numbers of your primary caretakers or specialists.
So we really should have basically a one sheet.
Exactly,
that you have
sheet or card.
Whenever you go to the
a
hospital.
5x8 card.
Right.
If you hand that to the hospitalist, immediately you've done 50 to 60% of their legwork already.
And let me clarify one other thing. People think about the prescriptions, but if they're taking any natural pharmacy, any vitamins or botanicals
Supplements,
or anything else as well.
Exactly, because they can interact with treatments and with medications, so yes. But once you say put all that information on a 5x8 card, you've created such a more usable and user-friendly and easy environment for the hospitalist to take better care of you.
So let me ask this. The hospitalist's job, my primary care physician's job is to help me be well as a human.
Right.
The hospitalist's job is not necessarily to do that. Their job is to get me out of the hospital in some ways, right?
Right.
So can I even expect to talk to them about all of who I am, or are they really just focusing
They're probably
on why
more
I'm there?
focused on the acute problem that they're dealing with because, yes, they're trained to take care of the whole person, but their job, say, if you're in the hospital for a urinary tract infection, is really to focus on that and what it's doing to the rest of your body.
So does that mean that I have to be sure that either I or my advocate, because again, you always want to have someone with you when you're in the hospital, is asking them whatever, if they're dealing with the acute item, how will that affect some other condition that I have?
Right.
So if they're dealing with the UTI and they give me antibiotics,
Right.
what else do I have to watch with regard to other conditions that I have, other medications that I have, et cetera?
Those are reasonable questions, but I wouldn't expect the hospitalist to say if you're being treated for pneumonia and then you start talking about a weight loss plan. That wouldn't be the time.
Right.
So we're dealing with the acute problem and also how the treatments are going to affect you and your other medical problems.
Okay, and then I just want to reiterate, because you've said in other conversations we've had, the importance of having an advocate with you.
Yes.
And I presume it's okay to ask the hospitalist when their rounds will be to be sure your advocate is there for the conversation.
Right, but don't always count on those rounds occurring at the time that was designated. Also remember, you have to get permission so that the people can talk to your advocate. It has to be usually written permission because, you know, there are HIPAA laws in place that say we can't talk to anyone else unless you give us permission, whether it's a family member or a friend.
Got it. All right, great advice. Thank you, David.
Okay.
If you like what you just saw, do me a favor, share it. The healthcare challenge is really a problem for all of us. And the more we can get this information out and get people taking better care of their health, the healthier we will all be. We have more videos with Dr. Sherer as well as his blog, What Your Doctor Isn't Telling You, at our website, bottomlineinc.com.